Hello, how are you? Mr. Cheswick, how are you doing today? I'm Evelyn. I'll be your CNA today. You okay? Good. Um, I'm here to perform some mouth care on you. Basically, brush your teeth and clean your tongue. Is it alright if I check your armband? I have to make sure of your identity. Thank you, Mr. Cheswick. Yes, you're Mr. Cheswick. Okay. What I'm going to do is a quick safety check, okay? Your bed is in a low, safe position. That's good. I'm going to give you some privacy. We're going to close a curtain. Okay. And I'm going to wash my hands and gather some supplies, all right? Okay. I'm back, Mr. Cheswick. This is our overbed table. I'm going to get a linen protector. I'm going to put that down on our overbed table to create a sterile barrier. I'm going to get one pair of gloves. If you all got the same hand. Okay, pair of gloves. We have I have a bowl I'm going to use for an emesis basin or a kidney pan. A cup of water. A toothbrush. We're going to put that down on our barrier, bristles up. And we're going to have some toothpaste. And we're going to need a towel. Okay? So we have a towel. Okay, I'm going to put on my gloves. And we'll begin. You having a good day, Mr. Cheswick? It's good. It's a beautiful sunny morning. All right. So what I'm going to do is I'm going to put a towel around Mr. Cheswick so that we don't get any toothpaste on him. Could you lean forward for me, Mr. Cheswick? Thank you. Okay. So we got Mr. Cheswick's clothing protected with the towel. Okay, now we're going to begin to brush Mr. Cheswick's teeth. I'm going to take my toothbrush and I'm going to moisten it in the water. I'm going to put a dab of toothpaste on, the size of a pea. Not much toothpaste at all. Okay, Mr. Cheswick, could you open your mouth? We're going to brush Mr. Cheswick's teeth. We're going to do the front, the back, the top, the sides. We're going to do the top teeth, the front, the back, the top, the sides. And then we're going to brush Mr. Cheswick's tongue. It's part of cleaning his tongue, is part of mouth care, so we have to brush his tongue. We're brushing his tongue. Then I'm going to place my toothbrush down on my barrier. I'm going to offer Mr. Cheswick some water. He's going to take some water to rinse his mouth. Then I'm going to hold the emesis basin. I hold it. Mr. Cheswick will spit up in the emesis basin. Thank you, Mr. Cheswick. Would you like some more water? We're going to rinse again. So Mr. Cheswick rinses again, and he spits in the emesis basin. Thank you, Mr. Cheswick. Then I take my towel, and I clean Mr. Cheswick's mouth. Okay, with the towel. Okay, then we take the towel, and we roll it away. You put this towel in the dirty linens. And what I'll do is I'll take my cup and my emesis basin, and I'll wash this out. I'll wash the toothbrush out. I washed and I dried my toothbrush and my emesis basin, and I will put these in the dirty supply area. I will take my toothpaste and I will put that in the dirty supply area. I will take my linen table, my linen protector, and I will throw that away. I'll move out of that table. Then I will remove my gloves in a way not to infect myself. Throw them away. Right. Then I will wash my hands. Then I will come back and I will check my patient, making sure that Mr. Cheswick is comfortable and that his bed is in a low, safe position. Mr. Cheswick has his call light in his hand. Is there anything else I can get for you today, Mr. Cheswick? Thank you. You have your call light. I'll be right out in the hall, okay? Would you like me to remove privacy? Would you like me to leave the curtain up or down? Remove it? Okay. Want the door open or door closed? Door open? Okay, no problem. Is there anything else? Just call me if you need me. You have your call light, okay? It's nice to see you, Mr. Cheswick. You look so nice today. I'll be back in here later to talk to you. If you don't call me anyway, I'll come back to see you. Okay. So, wash hands, right? Sanitize hands. Skill complete.